Bismillahirrahmanirrahim. Assalamu alaikum. My name's Dr. Ambereen Nahal. I'm a pediatrician and I'm a former medical director for the Massachusetts Public Health Agency, Mass Health, as well as a former chief medical officer in New York City for 14 centers. As you can see behind me in this Zoom background, I'm currently at MIT as a Sloan Fellow in the Sloan School of Management. And I'm presenting today on behalf of ISNA, as well as AMSET, or the Association for Muslim Professionals for Science, Engineering, and Technology. So just bear with me very quickly while I share my screen. And then, there we go. And then let's go to the beginning of this presentation. So what to do to prevent COVID-19 spread as per science, and what is your duty as a Muslim neighbor? Bismillahirrahmanirrahim. I have no conflicts of interest to disclose. What are our objectives today? To learn the basics of coronavirus, to understand spread and how to prevent it, be empowered to protect your family and your community, serve as a good role model, as all Muslims should always do, become a source of spread of factual and science-based information, and learn how to find up-to-date information yourself. So the reason I'm doing this as a slide presentation, and the reason I'm going to show you some videos from HHS or Health and Human Services, as well as the CDC, is so that you can yourself go directly to the source and get the information, because we should always be empowered with knowledge. What is COVID-19? It's the name of the disease caused by a novel or new coronavirus. It is in a similar family of viruses that cause a common cold or coronaviruses. And corona comes from describes the crown of spikes on the surface. It's considered an RNA virus, and this describes the type of genetic material inside. It's considered to have mutated, the genetic material mutated or changed its genetic sequence to jump from animals to humans. And this is why it has caused a pandemic, because our bodies have not seen this before. And it can cause very severe reactions in some people, and other people may not have any symptoms but are able to pass on the virus. So that's why social distancing is so important, because not everybody knows if they have the virus, but it can be spread very easily, like the common cold. It can be spread person to person via mouth and nose secretions through coughing, sneezing, talking, or singing. So to pause for a second, it's very important to think about this, because our communities often have very large weddings where there might be singing. And that singing can actually be the cause of spread, as happened in South Korea in certain churches, where one person could infect dozens of other people, and we have to be very careful about this. So I would recommend that really it's best to avoid weddings, even though that's very hard to do, but this is really, we're in an emergency situation. It's rarely spread by fecal route, so it's not typically a problem through food or dirty water. It can be spread by surfaces that are contaminated, so it's often because you touched your eye or your nose or your mouth with hands that you've used to touch something else. Wearing a mask, hand washing, and physical distancing are important to prevent spread. And hand washing should be for at least 20 seconds, and you should make sure that you cover all parts of your hands in doing so. Physical distancing is recommended to be at least 2 meters or 6 feet apart from other people, and we'll go over this in a little bit more detail shortly. When possible, do your tasks from home or online, whether it's banking or bill pay or shopping. Avoid large crowds, and consider using telehealth or online health resources, particularly for those who are elderly or have chronic illnesses. For some specifics on groceries, minimize your trips to the store. When you pick up an item, only pick up the one that you plan to purchase, not just picking up and then putting it down. Bring your 60% hand sanitizer along with you and use it when you're leaving the grocery store, certainly when you get in your car. Wash your hands, again, washing, making sure that you get everything, get your thumbs, wash your hands thoroughly. And I'm doing it too fast right now, but make sure you cover all parts of your hand. So wash your hands when you get home. Spread from food is very unlikely, so you don't need to go through any elaborate cleaning of surfaces or food, but do wash your hands again when you put your food away. If you want to wipe everything down, that's fine. And some people will leave groceries that are not perishable, in the garage for 3 days just to be extra safe. And I think there's no harm in doing that, but just be aware that it's not considered necessary. For cleaning, again, we don't know how long it stays on surfaces. Yes, it is safer generally to clean surfaces very frequently. You should use a type of cleaning product that is appropriate for the surface. But if you don't have a specific cleaning product, you can use a bleach solution of 1/3 cup per 1 gallon of water on hard surfaces. Please don't use something intended for hard surfaces on something like cardboard, especially for food items. Clean doorknobs frequently because this is touched all the time. Use gloves to protect your hands when cleaning from chemicals. Clean your cell phone or just avoid using it when you're out. And when you're, some people will shake their laundry, but don't do that because it may disperse the virus. For telehealth, this is a really great video.
The COVID-19 pandemic is altering almost all aspects of American life. During this emergency, we've seen a dramatic rise in the use of telehealth. Hi, I'm United States Surgeon General Dr. Jerome Adams, and here are 5 things to know about telehealth services. First, telehealth visits are safe. Virtual appointments lower the risk of spreading the virus among both the general population and healthcare teams. Second, telehealth enables those who are vulnerable to the coronavirus, like the elderly and those with compromised immune systems, to continue receiving some medical care safely and without office visits. Third, Medicare allows payments for telehealth services for beneficiaries wherever they are, even in their own homes. Prior to the COVID-19 public health emergency,
I'm going to stop there, but please be sure to consider this as an option, especially for those who need to have their medications filled frequently, as well as anybody who has chronic health illnesses that might need to avoid in-person contact. But do make sure that you check that it is covered by your insurance. Vaccination. Before we get into the specific vaccination, please, please, please do not forget to keep up with your regular vaccinations for your children, because that is extremely important to maintain, because those diseases still need to be protected against, like measles and mumps and pertussis and things like that. The flu shot is recommended. The season is coming up again, especially for those with asthma or chronic health conditions. Vaccine trials for the specific virus are underway, and we do consider them to be reliable, and it should be fine to get the virus when it's available, regardless of should be fine to get the vaccine when it's available. And in general, for any vaccine, it's more effective if more people get it. So we always recommend getting vaccines for public health. This is a quick overview, but I think the video will show it better. Wash your hands first before putting on your mask. Put on the mask over your ears. Cover your nose and your chin. Then you can go out and exercise. Bring along 60% alcohol so you can clean your hands frequently. And if you encounter somebody, stay 6 feet away. Protect each other. Okay? If somebody is infected and tests positive, they should stay in a separate room of the house, use a separate bathroom if possible, and if not possible, then the bathroom should be cleaned thoroughly after every use. All the surfaces should be cleaned. Avoid having shared meals or being in the same room. And if two people must be in the same room and one person's been infected, then that person should wear a mask, the infected person. And after 10 days and 24 hours without fever, it is considered safe to be around other people again. What is the difference between quarantine and isolation? Quarantine is when you might have been exposed to somebody. So maybe you were on an airplane, or maybe you went to visit a clinic for an appointment. You may want to stay away because you might have exposure even though you don't have symptoms. In comparison, if you test positive, then you should isolate. So it's not necessarily that different, but it is about just differentiating between who is maybe exposed as opposed to definitively infected. Being physically distanced does not need to mean isolation. Consider virtual celebrations through Zoom or WhatsApp. Arrange to maybe exercise together, whether it is actually exercising together, physically distance, or maybe just set a time and be on the phone and go for a run together or walk together. You can do virtual cooking classes or art classes, or you could do it, either like sign up for one, or you could maybe even, learn from your grandmother via Zoom or WhatsApp or FaceTime, in order, to learn to like kind of quote cook together. There are lots of online games. Mental health is extremely important because pandemics are stressful and they disrupt your normal patterns and habits. So even the most resilient and tough person might be struggling right now, and there is no shame in that. It's important to take care of your physical, mental, and spiritual health as one continuum. It's a good opportunity to perfect your prayers at home. Monitor your sleep and appetite patterns, as this is an indicator of many types of mental health issues. So if you find yourself unable to sleep, or you just want to sleep all the time, do consider whether that means that there's something going on that is an excessive stress. And admitting that you're experiencing this stress and getting mental help is absolutely allowed in Islam. There is no deficiency in your faith if you were to do that. Allah subhanahu wa ta'ala has, as a blessing and a benefit, has given us this resource that we can take care of ourselves. And there are several hadiths that say that, of all the types of blessings, our health and our time are the two that we waste and we don't appreciate, and that Allah subhanahu wa ta'ala does want us to take care of all of ourselves. This is a way to take care of yourself, particularly if you're elderly. This is a particular program for elderly people at home.
Hi, welcome to Go for Life, an exercise campaign from the National Institute on Aging at NIH. My name is Sandy McGrath. I'm a personal trainer and fitness instructor. We're going to do a sample workout.
So I just want to pass
So
forward.
even if you just lift just ever so slightly, it's a good thing. So we're going to do 10 of these and take it up. So we're working the backs of the arm.
So as you can see, they're using a chair. So it's very friendly to people who might have some limitation. And there are many of these videos for free available online. Take care of your community, your elders, anybody who's elderly who might have a disability. Consider arranging grocery services for them, or create a volunteer team who can go get groceries once and distribute it to many people. Share informational videos and have pro-social behavior and encourage that in others. So follow the instructions here as well as in other credible places. Set a good example for other people. As far as social justice, it is immigrant, minority, and low-income communities that are most affected by COVID-19, which aligns with the inequity that's called social determinants of health, or what kind of housing and transportation do you have? What kind of job opportunities do you have? Being able to work from home is a privilege, and so those of us who can avoid exposure should be grateful for that and give our blessings, but consider those who don't have that option. Small businesses have particularly been hard hit and do need to be very careful about maintaining safe distances while operating their business. And if you are a patron of a business, please consider giving a donation or helping them with their online services, just so that we can be very fiscally responsible on behalf of other people in our community. There's been an increase in xenophobia or fear of foreign people, and even though many of us may have been born in the United States, there is still a perception that we are foreign. And when there's fear, particularly fear of a virus, there can be increase in xenophobia. There is a very wrong and false use of a term China virus. I'm only saying it here just to identify it. It is not correct. We should always use scientific terms. We should not associate any one race or people with the virus. This could have happened anywhere, and it is now spread throughout the world. So please, please, please do not use incorrect terminology and be respectful. Be generous and be kind, and everybody is suffering, particularly to those who are delivering things to you, people who are in the grocery store working there. They are literally risking their lives to serve you. So please be kind to them. This is a resource in Urdu from the Australian government, but the virus is the same all over the world.
अपनी कम्युनिटी में कोरोना वायरस के फैलाव को रोकने के लिए हम सबको अपना किरदार अदा करना है.
I won't show you the long video, but there are resources like this on the web. And this is one for Somali from a refugee clinic.
Hi, my name is Dr. Michael Doe. I'm a pediatrician with the Valleywise Health Pediatric Refugee Clinic. I'm here to share an important message with you about COVID-19, also known as the coronavirus infection. To tell you more about that, we have Olia.
COVID-19 oo loo yaqaano coronavirus waa cudur neef-mareenka ku dhaca oo ku dhacay
It's got
ka caadiga
thorough
ah ama
information.
xanuun haddii caruurtaada aysan tegayn iskuulka
including how to
biyo
wash
iyo
your
saabuun
hands
si joogto
properly.
ah mar kasto aad
So consider ways that you can support your community and find them valid pieces of information, and be sure to share only information that comes from health sources like this: the CDC, the WHO, IMANA, Islamic Medical Association North America, ISNA, local, state, and state departments, your Department of Public Health, doctor's office. But please, 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 as Muslims, we have always been very pro-science. We've been a source of truth and justice. It is extremely important that we continue to do so. We should encourage each other to be the best of mankind, and to put our community's safety and well-being and our families' safety and well-being ahead of any personal interest or desire to have fun. Inshallah, we will again be able to live life in our normal manner. And I think if we can be creative, we can find ways to still live life and connect with each other and celebrate each other, while also being safe and respectful and taking care of each other. Thank you so much for your time, and I really appreciate your taking the time to listen. Jazakallah khair.